Pulses, remember, in our 1000 class. It's been a while, and we never really got to put it to practice. I don't know if Christy ever got to show you. I doubt it. I know she had a lot that she had to do. So this is our Doppler. And so let's go back over what we talked about in class today. So our first thing that we're going to do is to try to feel for the pulse. Okay? In this situation, because we are assessing legs, the flow in the legs, the two pulses that we're going to try to assess are our dorsalis pedis and our posterior tibial. Okay? So your dorsalis pedis runs down the top of your foot. Oh yeah, she got a good one. I mean, I just laid my hand on it. This is a 3. This one, and so when you feel her pulse, if she had her sock on still, you would feel this really well through the pulse, through the sock. The pulse through the sock. My old brain switches things around on me. All right? Oh, your toes are pretty too.
Yeah, I was looking at the light. I
color.
can't even take mine out of
I
the
don't want to volunteer my toes. I know. I like to do that too.
Mine are winterized already.
So when you go to find that pulse, so some of them are not going to be like this, the one that, like I told you, just jumps out at you. And so the best way that and this is the way I was taught and the way I try to teach, is there's kind of like a little groove right here at the top of or on your ankle, okay? You kind of want to run down that groove, and usually, and that's exactly where hers is. Now, if you push too hard, now not hers, but other people's, you could occlude. So you do want to kind of have a light touch, but you do have to touch the patient, okay? You can't. Some people, again, it's gonna be harder to feel than others. But right along the top is where we're gonna try to feel. If you don't feel it, you're gonna just do some shifting very slightly, one way or the other. Try to feel for it, okay? But right in this area, she's got a great pulse. All right, can you kind of turn your leg out for me? Mm-hmm. Okay, so you might have to come a little closer. So your posterior tibial pulse, we're gonna find on the inside of the foot, okay? This bone right here. So you wanna kind of think about this bone coming to a point right about here, okay? And right behind that point is where we're going to try to feel. I think I feel it. It's not as great as for her dorsalis pedis, but once I go to Doppler, I'm sure you're going to be able to hear it well. You do need to know the names of these pulses. I'm going to ask you, okay, what pulse is that? Posterior tibial. What pulse is on the top? It's your dorsalis pedis. Okay. Now, like I said, in the patients that we're going to have out in the field, though, right now, all of us, it's almost like a little cheat, because you're going to be able to feel it, most likely, on all of you. And so it's going to be easier to Doppler. When you actually get in the field and you have those compromised pulses, it is going to be harder. But again, practicing on people that have a good pulse helps you to get that orientation as to where you should be finding the pulse. Okay? Same thing with echo. You know, I know Christy talks to you guys about that right now, more in the spring, I would say, it's going to get a lot easier, because you're not seeing any kind of pathology. You don't have people with a really thick chest with lots of disease issues. Once you get in the clinic, that's when it really gets challenging, because you do have those kind of patients that are harder to get the windows. And then maybe a few of your classmates don't have great windows, but almost every one of your patients are not gonna have good windows, you know, once you get out. And so again, dealing with the peripheral vascular disease, quite often people are not gonna have good pulses, okay? So we are gonna Doppler, all right? Turn back over and I'll do the dorsalis pedis. You see how she's laying flat? This is important as well. You don't want them sitting up. You don't want their leg bent because that vessel runs all the way through their groin, their knee, all the way down. And if there's any bend, it's going to compromise some of the flow as well, okay? We're going to use gel, just like we do for echo, okay? And this might be a little cold. I'm just gonna go ahead and put a little glop where I think it's gonna be. Now, obviously you can do it that way, or you can get your Doppler and put it on the actual probe, okay? I'm gonna turn on the probe. And we're gonna listen. I always like to test, just make sure if it's turned down too low, you're not gonna hear anything. So this is our little volume control. And there's gonna be different Dopplers out there. You're just gonna have to kind of learn your Doppler, okay? Now the biggest thing is that you need to understand that the surface of the Doppler needs to kind of be at an angle. So you can't go in straight up and down. Now on her you might, because like I said, she's got a massive pulse. But you can't go straight up and down. You want that blood flow coming towards this surface. So you are gonna have to come in kind of at an angle, okay? And of course I'm right on it. And she's got a really nice, strong pulse. Now this is so if you're not on it, I don't hear anything. See how I'm moving gently, gently, gently over back on top of it? I keep moving, I'm going away from it. I'm not gonna hear anything. Okay, so as I'm searching for it, if you don't have someone with a really strong pulse, then you're gonna just make very gentle. You don't wanna do all this, trying to find it. It's very gentle, subtle movement to try to locate it, okay? Okay, nice, good pulse. Could you grab me those paper towels? I think I sit them in the window over there, a roll of paper towels. And we will do the posterior tibial. Thank you. Again, I guess I could have left it if you're gonna, some of them are going to be practicing on you. Go ahead and turn your leg out again for me. And I'm going to go ahead and put some right there. Now because I didn't feel it as well, I may have a little more trouble. There it is. I'm just moving very, very subtly. I think I'm off of it again, so I was trying to move to see if I'd get it a little louder. This crinkly paper doesn't help, but
I can kind of hear it.
yeah, too. It is there. It's not as strong as the DP. But it is there.
It's been
Yep. Okay, so that's what you need to do.